Hello, my name is Brooke Thomas. I'm the orthopedic coordinator at CaroMont Regional Medical Center. We are so excited that you made the decision to move forward with your hip or knee replacement. Over the next hour, we're going to review some information to help you feel more prepared about your upcoming surgery. Congratulations on making the decision to get back to the activities that you once enjoyed.
Here you will see the cover page of our knee and hip replacement patient guide. It's got about 60 pages of some really good information, and it has a lot of the same things that we're going to talk about today. If you do not already have one, I encourage you to stop by your surgeon's office and ask them for a copy. So listed here, you'll see the main topics that we're going to talk about today. We'll talk about some preoperative information, so the appointments that you're going to have before surgery, what you'll need to pack in your suitcase, some exercises you can do to get yourself ready, and how to prepare your home so that it's ready to go when you get home from surgery. We'll talk about the actual surgery itself, so a little bit about the implants, recovery time, when you'll check in for surgery, and what to expect as far as anesthesia. We will review the hospital stay, which will include how long you'll be here, the physical therapy that you'll have, what you can do to reduce your risk of developing complications, and how to best manage your pain. And then we'll also talk about discharge plans, so what kind of physical therapy you'll need after you leave the hospital and what kind of equipment. We have a lot of patients that think this slide is pretty funny because they can relate to it. We have patients that tend to put the surgery off and put it off and put it off until they just can't put it off anymore. And then we also have patients who are the opposite and want to come in and get it done as soon as possible. Either way, we have these classes because patients tend to have better outcomes and they are less anxious when they know what to expect from the surgery. Now we're going to review a brief to-do list for before surgery. And if you actually have your patient guide at home already, you can look after that first divider in your book. There's a big green box, and those will be the different things that we're going to review now. One thing you'll need to do if you haven't done it already is pre-register. And if you have your patient guide, that phone number will be in there. But if you do not have that guide, that phone number is 704-834-2914. And basically that gets you checked in our computer system so that you'll be ready to go on the day of surgery. The next thing on our list is the preoperative education class. So if you are watching it right now, you'll be able to check that off your list. You will have a preoperative appointment with your surgeon, and sometimes that's an actual sit-down appointment, and sometimes the surgeon just says, come to my office, I'm going to give you some paperwork, and you're going to take that on to another appointment where you'll have your lab work done. So it's possible you may have a day where it looks like you have 2 appointments back to back. If that's the case, it's okay. Sometimes they plan it like that, and those appointments are right down the street from each other. The pre-anesthesia screening services appointment is where you have your lab work done, and that's also where they will collect the information so that the anesthesiologist has what they need on the day of surgery. And we're going to talk more about that appointment in just a minute. You may also have an appointment with your primary care physician, or if you see a specialist for your heart or your lungs, your surgeon may want you to check in with them prior to surgery just to make sure you're as healthy as you can be and kind of cleared for surgery is what they call it.
If your surgeon has asked you to see your primary care physician prior to surgery, they want you to get a general checkup to make sure you're as healthy as you can be before surgery. The healthier you can be, the more likely you'll have a great outcome. Things that they'll look at are diabetes. If you are diabetic, we strongly recommend that you have a hemoglobin A1C of less than 7. This looks at your diabetes over the past few months. If your blood sugars have been pretty well controlled, then your A1C should be less than 7. When it's not, this can put you at a higher risk for complications and infections. BMI is your body mass index. That looks at your weight in relation to your height. We really like that to be less than 40 prior to surgery. When it is, patients tend to have better outcomes. If your BMI was greater than 40, your surgeon has likely let you know this the weeks prior to surgery. If you are a smoker, we strongly recommend that you quit smoking at least a month or 2 before surgery. Smoking can increase your risk for surgical site infections and can also cause lung problems like pneumonia after surgery. If you are a moderate to heavy drinker, we strongly recommend that you try to wean yourself down or cut down the amount of drinks you're having the month prior to surgery. We do not want you to try to quit cold turkey, as this can cause complications. So we recommend that if you are going to drink alcohol, that you do not have more than 1 or 2 drinks per day the month prior to surgery. If you have any infections that can be cleared up before surgery, we definitely want you to do that. Those include things like tooth infections, like an abscess or a urinary tract infection. We don't want any bacteria floating around in your body if we can help it. And then if you have any type of medical conditions, lung problems, heart problems, we want those to be as stable as possible before surgery to decrease your likelihood of having any type of complications after surgery.
Pre-anesthesia screening services is an appointment that you'll go to have lab work done and give your medical history so that the anesthesiologist has the information that they need on the day of surgery. This appointment is in the Gaston Professional Building. It's right next to the hospital. So if you were on Court Drive, you would see a letter C out by the road, and the building is noted at the bottom of the page. You can see it. It's on the first floor, and they'll do your lab work at this appointment. So if you want to eat or drink beforehand, that's totally fine. They'll be looking at your electrolytes, your blood levels. Sometimes they'll do a urine specimen, and they'll also do a MRSA screening, which is where they put a little swab in your nose. If that screening comes back positive, it just means you've had some of that bacteria on your skin. It does not mean that you have an infection or that you're going to get one. If we find that a patient has that bacteria on their skin, we do like to use some extra body washes to help get those germs off. And we also have patients use an ointment in their nose. So we'll let you know if anything looks abnormal on the lab work, but typically we tell patients no news is good news. At this appointment, they'll also review your medications. So if you can actually bring your medication bottles to this appointment, that's what they prefer. That way they can look at the exact instructions, make a list, and that's how the doctor will know what to put you on after surgery. So that means anything that you're prescribed, even if it's vitamins, supplements, or anything that you take on a regular basis, they will want to know that. They will review your medications, and they'll let you know if there's anything that you need to take on the morning of surgery before you check in. If you are diabetic, they'll also make sure you know what to do with those medications that night before surgery and the morning of. If you are on any blood thinners, they'll make sure you know when to stop taking those as well. Another thing they'll review is your medical history and any allergies that you have. If you are allergic to certain things, make sure you know what happens when you take those medications, because that's important when it comes to the physician ordering things like antibiotics or a medication. They will give you 2 bottles of the body wash that you see on the screen. It's in a white bottle. It's called chlorhexidine, And that body wash will help get the germs off your skin. So we will ask you to use that the 3 nights before you check in for surgery. You can take your regular shower, you can wash your hair if you want to, and then you will want to use this body wash after that. So this wash is used from the neck down. You basically rub it in. You just rub it in gently. You don't have to scrub real hard. You want to let it stay on your skin for about 2 minutes before you rinse it off. When you get out of the shower, if you can use a clean towel, that would be the best thing, because that way you're not putting germs back on your skin. When you get out of the shower, you want to make sure you do not put lotion or cream or powder on, because what will happen is the ingredients that make the body wash work, it'll stick to your lotion or your cream, and it won't stick to your skin. And we need it to stay on your body so that it continues to kill the germs. If you can, put clean sheets on your bed that night before surgery and wear clean pajamas. That way you're not putting extra germs back on your skin as much as you can help it. If they tested you for MRSA and the results came back positive, the surgeon's office will ask you to use this body wash the 5 nights before you check in instead of 3 nights. On the screen you'll see a handout, and this is something that you should expect to get from your surgeon. If you don't see it, it's also in that notebook that we talked about earlier on page 12. And what this is going to tell you to do is start drinking plenty of fluids the day before your surgery to get you hydrated. And it's also going to tell you to take Tylenol or acetaminophen starting that day before surgery. So in regards to the fluid, we want you to try to drink 8 glasses of something like water or Gatorade, something healthy. We prefer it not be caffeinated type drinks or drinks with alcohol in it. We really just want to get you well hydrated, because they'll tell you not to eat or drink anything after midnight that day before surgery. So if you have a type of medical condition and you're not allowed to drink that amount of fluid, just go by your normal fluid intake. And if you're diabetic, you want to choose the sugar-free options. You don't want anything that's going to drive your blood sugar up, especially that day before or morning of surgery. We also instruct patients to take Tylenol or acetaminophen. Those are the same thing. We have patients start doing that the day before surgery. The reason we have patients do that is because getting that Tylenol or acetaminophen in your system actually allows your brain to tolerate the pain better. While you're in the hospital, we will continue to give that to you, and I encourage you to make sure you take that medication even if you're not really hurting, because that's going to help keep you comfortable and help keep your pain better controlled. When people get that Tylenol in their system, they don't need as many of the narcotics or the stronger pain medicine that sometimes make people feel a little bit groggy or sometimes nauseous or hungover type feeling. If your doctor said you'll be staying a night in the hospital, you won't have to bring much. Just plan on bringing things like toothbrush, toothpaste, hairbrush, deodorant. If you want something to keep yourself occupied, like an iPad or a laptop, you can do that. If you have sleep apnea, just bring your actual mask or the mouthpiece. You don't have to bring the whole machine. We'll use what we have in the hospital for that. Whether you were planning on leaving the hospital the same afternoon as your surgery or spending the night, you'll want to bring clothes that you're comfortable exercising in and that are easy to get on and off. We prefer usually a baggier pant because Sometimes there's still a bulky ACE wrap or bandage on your leg, so you want to make sure you can get it over that bandage fairly easily. A lot of times the jogging pants with the elastic around the ankle can be a little bit tight, so we prefer that you don't have those, just because sometimes that leg's a little swollen and we might have to cut the bottom of your pants. So something with a wider ankle or a wider leg usually works well. Shorts are great and they're easy to get on and off, but we know sometimes it's a little cold or sometimes people just don't feel comfortable in shorts. But if you feel okay with that, that's a great option. For ladies, we do ask that you do not wear gowns or skirts, because sometimes we'll take you down to a therapy gym to do some of your exercises, and if you have to lay on the bed or the exercise table, we'll be lifting your legs, and sometimes there's other patients in there, so we don't want you to feel uncomfortable. Any kind of shirt is fine, and if you tend to get a little chilly, you might want to bring a sweatshirt or a little jacket. Here's a couple things you can go ahead and do to prepare your home. Most all patients are going to be using a walker for at least a week or two after they leave the hospital. So plan ahead, make sure the pathways are clear in your home so that you can get a walker through those areas fairly easily. Think ahead for meals. It is a little harder to maneuver in the kitchen with a walker, so if you do not have somebody to cook for you, plan to have some easy meals that you can pop in the microwave or some sandwiches that you can fix yourself. If you have any decorative rugs or anything that's sitting out that you could trip on, make sure you put those away for at least a couple weeks after you get home. Most patients say that they prefer to sit in taller, firmer type chairs when they first get home from the hospital, something similar to a dining room chair. Those armrests make it a lot easier to get up and down. Probably similar to the way it is now. If you have a chair that you're sitting down in and you're sinking down into it and it's low, it's just harder to get up from those low positions. If your only bedroom is upstairs, you may want to plan on sleeping somewhere on the main level of your home for at least a few days. Make sure to let our physical therapist know where your bedroom is. That way they can practice with you. We will teach everybody how to go up and down stairs so that if you encounter stairs in the community or getting into your home, you'll know how to do that. Lastly, it's always a good idea to have a few nightlights out, especially in the evening. You want to make sure you can see as clearly as possible so you're not at risk for tripping and falling. Here you'll see a couple exercises you can start practicing before your surgery. And these are the same for people having knee or hip replacement. You won't have time to build a lot of muscle, but it does make it a little easier to get that surgery leg in and out of bed when you've had a chance to practice these. If it hurts too much when you're doing these or you just can't do it, just skip it. The first one is called a straight leg raise, and you want to do this when you're laying down. So most often patients will do it before they get out of bed in the morning or when they're going to sleep at night. You do not have to get on the floor like this person is here. But what you're going to do is bend the leg that you're not having surgery on, because that's going to take some pressure off your back. The leg that you are having surgery on, keep it straight. You want to tighten that muscle in your thigh area and just slowly lift and lower that leg about 10 times. You can do that in the morning and again in the evening. That's what we recommend. You don't have to lift your leg real far, but just do what you can. Some patients will only be able to lift it a few inches, and that's okay. This second activity is called sit to stand, and you don't necessarily have to do this over and over again like an exercise, but this will help take some pressure off your joints if you can follow these steps. When you're getting out of a chair, you want to scoot your bottom to the very edge of it. You then want to kind of lean forward so your nose is over your toe area. And then you want to hold on to the armrest or the seat of your chair and slowly lift yourself or push yourself up and forward. If you're able to do that a few times, you can, and that will help kind of strengthen that muscle in the back of your arm or strengthen that tricep. Otherwise, following these instructions will just kind of help take the pressure off your joints when you're getting up from a seated position. Here we'll talk a little bit about the total joint surgery itself and what to expect after it's over. After surgery, you can expect to get rid of that arthritis type pain. You will not feel that grinding sensation that you had before. However, it is expected that you'll have some surgery pain as it takes time for those muscles and that incision to really heal. You can expect to get better range of motion and movement out of that joint. However, a lot of that will depend on the exercises and the effort that you put into physical therapy. It will be very important to follow your therapist's instructions in order to really get those results that you want. How long do these implants last? They used to last closer to 10 or 15 years. However, a lot of them are lasting up to 20, sometimes even up to 30 or more years. Will you set off a metal detector? Yes, you will. So when you go to an airport, just plan on getting scanned. Same goes for government buildings. Patients are typically still using a walker by the time they go to their follow-up appointment with their surgeon around 10 to 14 days after they leave the hospital. If they're doing pretty well, then the doctor may let them start using a cane and go from there. Most patients are going back to driving between 3 and 6 weeks. However, a lot of that depends on which leg you have surgery on. If your surgery is on your right leg, you really just have to make sure you can get between the brake and the accelerator easily, and you also have to be careful about the pain medicine. Patients typically return to work between 1 and 3 months. However, most of the time it's closer to the 3-month mark. If your job is fairly low-key and everything has been going very smoothly with your recovery, then they may let you go back closer to 1 or 2 months, but most patients it's between 2 and 3. Long-term recovery, you may have heard that it can take up to a year to get the full results of your surgery. And that just means to feel as good as you're going to get, it can take that amount of time. Sometimes hip replacement patients feel those results a little sooner, sometimes around the 7 or 8 month mark. So it is normal to have swelling around that joint, sometimes 3 to 6 months after the surgery. It's going to take time for that tissue to really heal. Sometimes there's a little numbness around that incision as those nerve endings are healing also. Most commonly, patients end up having the total joint surgery because they have osteoarthritis or degenerative joint disease or some kind of condition where that cartilage wears away on the ends of the joints. As you can see in the picture, that white area on the end of the joint is the cartilage, and it has worn away. So when someone is walking and they have arthritis, they have a lot of pain and stiffness and grinding because the bones are just kind of rubbing against each other. And a lot of times you'll hear your surgeon say you're bone on bone, and that's what he's talking about. Many patients will try things like medications or sometimes injections to kind of help with that pain and to get them through just a little bit longer. But a lot of times that's a short-term solution, and the actual joint replacement is what ends up being the long-term solution. Here you see a picture of a knee, and it actually has a joint replacement on it already. But that upper bone you see towards the top of the picture, that is the femur bone. That lower bone, that is like your shin bone or your tibia bone. And that little circular piece on the top bone, that's going to be your patella or your kneecap. So when it's time to do the actual knee replacement surgery, the surgeon will make an incision right down the front of the knee. They will shave off the very end portion of that top femur bone and that bottom tibia bone. They use very precise instruments so that the cuts are just right. They will have different size implants available, so it's not a one-size-fits-all. They will look at your bone, they look at x-rays, and they will decide which size will best suit you. The actual procedure takes usually about an hour and a half to 2 hours. If it's a revision surgery and they need to remove an old implant, usually that surgery time is closer to 2.5 hours. The implants are made out of a combination of different metals, so it's mainly chrome, cobalt, titanium. The white piece that you see in the middle, that's going to be like your new cartilage, and it's a polyethylene type material. And after the surgery is over, you will go to the recovery room. Here we're going to talk about the hip replacement surgery. So this is a picture of someone's hip. That large butterfly-looking bone, that is their pelvis. That circular bone where you can see a little bit of arthritis where it's going into that pelvis area, that is called the femoral head. And that long bone that's going down into the leg, that is where you'll see the femur. Here's where you see a breakdown of the actual hip replacement procedure. So as far as the implant goes, you'll have a rounded piece that's hollowed out in the center. That is going to be the socket piece that goes into the pelvis. You will have a round ball. That's going to be your femoral head. And it's going to be attached to a stem or a long cone-like piece that's going to go down into the femur bone. So in picture 1, you see where they remove the femoral head or the ball of the femur. In picture 2, you can see the hollowed out piece that they're putting into the socket of the pelvis, and they are going to put the new ball or the femoral head and the stem down into the femur bone. Okay. For these implants, they typically use a rough material so that the bone grows to the implant. A lot of times with these elective total hip replacements, they do not need to use a cement or a glue. So over the next several weeks, the bone will grow to that implant, but the surgeon may ask that you do not put 100% of your weight on your leg right after surgery. We will have a physical therapist that comes in to talk to you, to talk about any precautions or to talk to you about how much weight you'll be able to put on that leg right after surgery. One thing about hip replacement is that you do have to follow hip precautions for usually 6 to 8 weeks after surgery. And that just means you'll have to be careful about certain activities so that you do not dislocate or pop that hip out of place. Once the muscles and the surrounding tissue heal and they become strong, then you'll be able to go back to those normal activities without worrying about a dislocation. So this procedure also takes about an hour and a half to 2 hours. Sometimes that incision is a little bit more towards the front of the thigh, and sometimes it's a little bit more towards the back. The material for the implants is the same as it was for the total knee. It's a combination of different metals, and sometimes they'll use a ceramic ball instead of metal for these. Here we're going to talk about the process for checking in and getting ready for surgery, and then what you'll expect while you're here in the hospital afterwards. So here's our checklist for surgery, and we're going to go back to the 3 nights before surgery. That's when we're going to start using our body wash or the chlorhexidine that we received in that pre-surgical testing appointment. We're going to tell patients, do not shave that leg that you're having surgery on that night before surgery. And even if you can go a couple days without shaving, that would be great, because any nicks or cuts can be an entryway for bacteria. When you check into the hospital, if we need to remove hair, we will use clippers. As far as your surgery time goes, the hospital will call you the day or two before surgery, and they will let you know what time to arrive. If you're having surgery on Monday, they typically call patients on that Friday before, and if your surgery is any other day during the week, they'll call you the day prior. If you have not heard from anyone and it's about 3 p.m. that day before surgery, you are welcome to call, and they will make sure you know what time to arrive. First surgeries of the day start at about 7:30 in the morning, and they'll typically have you get here a couple hours before the actual start time, so it is possible that you could arrive as early as 5-ish in the morning. Sometimes those surgeries go up until lunchtime or early afternoon. That morning of surgery, make sure you don't eat or drink anything unless you were instructed that you may. It is okay to have that Tylenol with a sip of water, and it's okay to have any medicine that they told you to take in that pre-surgical testing appointment. You just want to drink enough water to get that medication down. As far as where you will go for the actual surgery, most of the procedures are done at the main hospital, but some of them are done in the outpatient surgery center right next to the hospital. And I'm going to pull up a map in just a second to point that out to you. So just follow any instructions that you're given about checking in, and they'll tell you exactly where to go. No matter where your surgery is, everybody will come to the same orthopedic department after it's over, and that is located in the main hospital. Once you get checked in, the staff is going to wipe your body down with these body wipes called Sage wipes. It has the same chemical in it that the body wash has, and that's going to help get the germs off your skin again. They will take your blood sugar, and if you're diabetic, that's probably nothing new for you, but if you are not diabetic, they're going to check it. If it is high when you come into the hospital, they will continue to check your blood sugar before meals and at bedtime. If your blood sugar is high, they may give you a little bit of insulin. And that's just because keeping blood sugars well controlled in the hospital, it actually allows your body to heal better, and it decreases your risk for complications or infections. If you are not diabetic, but your blood sugar was high in the hospital, we will not send you home on medication, but we will ask you to follow up with your primary care doctor after leaving the hospital. And then they will also apply a nasal antiseptic in your nose, and that will help protect you so that when you're breathing during surgery, no bacteria is getting near your incision or near your surgery site.
Most patients have surgery in the main hospital. If that's going to be the case for you, we ask that you park in the patient visitor parking lot. It's to the right of the hospital. When you enter through those doors, you'll be on the basement level, and if you just head towards your right, you'll see the registration area close by. Just check in at the desk, and they'll get you situated. If you're going to be having surgery at the outpatient surgery center, you're going to be parking in Drive D. So once you go through Court Drive, you go through entrance D, and you'll park in that parking lot to your right. Once you enter the building, just check in at the desk. As the patient, you'll go to pre-op holding, and that's where you'll talk to the anesthesiologist, and you can ask him any questions that you might have. If they are doing a regional block, which they typically do for knee replacement, they'll do that in that pre-op holding area. Then you'll go to the operating room where you'll be for the next hour or two. After that, you'll go to the recovery room, and that's where you'll stay until you're more awake and your pain is managed. After that, you'll go to the orthopedic department or the day of surgery unit. So if you're leaving the same day as your surgery, you'll go to the day of surgery unit, and that's where you started off at when you first checked in. If you're going to be staying the night in the hospital, you'll go to our orthopedic department. When it comes to anesthesia, most patients will end up with what's called spinal anesthesia. There are a few patients that are not going to be appropriate for that, and those are patients with a history of aortic stenosis. Typically, those people see a heart doctor for that. It's a narrowing in part of the heart. Sometimes they cannot use spinal anesthesia if they're having hip replacement and they're doing the incision near the front, and that's just related to the positioning with the surgery. And then sometimes if patients have had lower back surgery before and they have metal, or if they've had certain procedures in a certain area, they may or may not be able to do spinal anesthesia for those patients. But for the most part, the patients that do have spinal anesthesia will have this administered into the lower back area. It's injected. It's a one-time injection. It will numb the legs and keep them from moving during surgery. Patients also get medication through their IV that helps put them to sleep, so they are not awake during the procedure. Once the procedure is over and they wake up in the recovery room, their legs will still feel a little numb and tingly, and typically that will last for the next couple hours. If a patient does not have spinal anesthesia, they will have general anesthesia instead. It's just a little deeper of a sleep where they use more of the machines and the medications to help with the breathing. After surgery, patients will not experience that numb, tingly feeling in their legs. Either way, anesthesia really just wants to do whichever is safest for the patient. But if you have any questions, please feel free to ask them or talk to them before the procedure. For patients having knee replacement, they will also have what's called a regional block, and that is done before the surgery starts. It's an injection that goes into the thigh area. It's called an abductor canal block, and it will inject medication so that it provides pain relief right around the knee. It does not make you feel groggy or nauseous. It just provides some additional pain relief that will last about a day or two after the surgery. Hip replacement patients do not get that same regional block. Typically, they do not experience the same amount of pain. So this is just reserved for the knee replacement patients because their procedure is considered a little bit more painful. So you can plan to be in the operating room for about an hour or two. If you're going to have a Foley catheter to drain your urine, they'll insert that while they're in the operating room. They usually don't stay in very long if you do have one. A lot of times they'll take that out the evening of surgery. You'll see here there are some different bandages that they use. If you're having knee replacement, you'll probably see an ACE wrap like that top picture and the middle picture. But before you leave the hospital, you'll probably see that beige color bandage, which is called an Aquacell. Some patients may have a negative pressure bandage like you see at the bottom. There's a little circle at the end of it. It connects to a device, and sometimes that's used to kind of help keep the incision lines pulled together. If you're having hip replacement, you may just have a gauze bandage with tape over it, but a lot of times you'll also have that Aquacell, that beige color bandage that you see to your right. Typically, our orthopedic patients that are staying the night in the hospital will go to the Human Motion Institute on the 3rd floor. We'll have total joint replacement patients there, spine surgeries, fracture patients. I will say, however, that during COVID, departments had to be a little bit more flexible, so there is a chance that the orthopedic patients may be housed on a different unit, but a majority of the time we will be on the 3rd floor Human Motion Institute. Here you will see our surgeons and our hospitalists. Our surgeons are top to bottom Dr. Thomason, Dr. Matra, Dr. Prato, and Dr. Prater. Our hospitalists are Dr. Akong and Dr. Maduri. The hospitalists will see our patients that spend the night in the hospital, and they'll oversee their general medical care. Our surgeons are going to focus more on the actual surgery site and the pain management. When it comes to physical therapy, our goal is to get you up and get you moving the same afternoon you had surgery. So for some people that might mean taking a few steps. For some, they might sit in the recliner for a little while, or some might have a full therapy session, especially if they're going home that same afternoon. We do want you to plan to have somebody with you during your therapy sessions in the hospital so that they'll know how to help you once you get home. Your therapy sessions may be done one-on-one with a therapist, or they may be done in a group setting. We do have a gym that has exercise tables, we have stairs, a car, so you may go down to that gym area and be doing some exercises with other patients that had the same surgery as you.
Managing your pain is an important part of your recovery because we know that your pain has to be controlled so that you can participate in your physical therapy. So at CaroMont, we use a multimodal pain approach, which means that we use different kinds of medications to work on the brain and the body in different ways to help give you the best result with your pain. So prior to surgery, we will give you some medications. You will get some during surgery, and then you also get medications after, and they all work together to give you the best result. You'll notice that after surgery, you'll automatically get the Tylenol or the acetaminophen that we talked about earlier, and you'll also get an anti-inflammatory automatically. But other than that, we do need you to work with the nurse to help let her know when you're ready for more pain medicine. She will ask you to rate your pain on a scale of 0 to 10. 0 is no pain at all. 10 is the worst pain you can imagine. So just give her a number the best you can so she can help match up your pain medicine. Now, it's important that you do not wait until your pain is a 10 before you ask for medication, because then it's really hard to get you comfortable and it's hard to get that pain back under control. Now, unfortunately, we cannot give everybody medication on a schedule because people respond to it so differently. Some patients will sleep all day after taking a pain pill, while others might need something the next hour. So we really have to look at each specific patient. I would recommend taking something when maybe your pain's around a 4 or a 5. Keep in mind that it can take 30 or 45 minutes for pain pills to really kick in, so that's another reason you don't want to wait until the last minute to ask for medication. Ice packs or cold machines are also great for pain. They also help with swelling. If you're having knee replacement, we will automatically put a cold wrap on your knee. It will be connected to a machine, and it can stay on all the time, as much as you feel comfortable with it. Ice packs are typically used for our hip replacement patients. And then when patients go home, sometimes the physician will offer a cold machine if you've had knee replacement. They are great if you choose to get one. If you choose not to, I do recommend that you plan to use some type of ice pack or gel pack. You could even use a frozen bag of peas, or we do have recipes on how to make your own ice packs in the patient guide if you wanted to do that. And keep in mind also that physical therapy can actually help get some of that stiffness out and can help with some of the pain that you may feel, especially first thing in the morning. Another thing that's very important after these types of surgeries is preventing blood clots. If you were taking some type of blood thinning medication prior to surgery, you'll most likely be placed on that same medication after surgery. If you have not been taking a medication, you can plan on taking something for at least a month or two after you leave the hospital. The physician will write you a prescription, and we just strongly encourage that you take it exactly as prescribed. The type of medication really depends on the patient and their medical history. Sometimes it's something like an aspirin, and sometimes it needs to be something more like an injection. We will also have you wear TED hose while you're in the hospital and after you go home. Those are the stockings that you see at the top of the screen. They help with circulation and swelling. The wraps that you see in the middle of the screen are called SCDs. They pump with air and they help circulate the blood while you're in the hospital. And then just doing your daily exercises that you're instructed to do, walking, tightening your muscles, all of those things will help circulate the blood and prevent blood clots. We also pay close attention to how to prevent pneumonia after surgery. And one of the easiest things that you can do is sit upright during the day. You can sit in your recliner or sit in your chair. Coughing and taking good deep breaths every once in a while is also a good way to kind of clear out your lungs. And using the incentive spirometer like you see on the side of your screen. After your surgery is over, your nurse will bring you an incentive spirometer. To use this, you put your mouth over the end of the hose. You take a slow, deep breath in, like you're drinking a milkshake. You see how long you can hold that breath in, and then you let it out. That's going to expand your lungs. It's going to help get any mucus out that may have accumulated in there after surgery. And that is what will help prevent the pneumonia. It's very, very important, especially if you've had a history of lung problems like asthma or COPD, or you've been a smoker in the past. If you don't have one of these at your bedside for some reason, you can always cough a couple good times, take some deep breaths, and this does the same type of thing for your lungs. Preventing infection is also a very important part in your recovery. One of the things we will do to help protect your incision is place a waterproof bandage on your leg before you leave the hospital. That is what you see on the upper part of your screen. It's important that you actually keep this bandage in place until you go to your surgeon's office. They will remove it at your follow-up appointment. And this could be anywhere from 8 to 14 days after you leave the hospital. As long as you don't have any drainage dripping out of the side of your bandage, or as long as it's not coming off, it's perfectly fine to leave it in place. It is normal to have what looks like globs of blood underneath that bandage, as you see on the screen. If you have any concerns about it, just call your surgeon's office. They'll typically just have you come in, they can check it out, and they can place a new bandage if they need to. It is okay to shower as long as this is sealed well against your skin. However, I do not recommend that you submerge your leg underwater in a bathtub or water. It's important to also clean your shower head before you even have your surgery. As you see in the screen, the shower head has several different little holes in there. We recommend that you use a Clorox or a bleach spray to clean that shower head so little particles of mold are not coming down on your body when you're taking a shower. That's especially important when you have a fresh incision and that bandage has just been removed. We recommend that you use clean wash rags when you wash over that surgical leg. We do not want you to use the same washcloth that you use to clean your feet or clean your backside. Reserve a special clean washcloth for that surgery leg. We will give you some of that body wash that you used prior to surgery. We'll give you that again when you leave the hospital, and we'll tell you to start using that after the doctor removes that surgical bandage on your leg. So most patients really won't need to use it until a week or two after they leave the hospital. It's also important that you check your temperature daily when you get home from surgery. If you're having fevers over 101, those can be signs of infection, so you'd want to let your surgeon's office know that. If you plan to go to the dentist, we recommend that you wait at least 3 months after your surgery before making any routine dental appointments. You may have had a dental appointment prior to surgery, and that's totally fine. But after you've had your surgery, we like you to wait at least 3 months to really give that joint replacement time to heal. There is a slight chance that bacteria could get into your gums and travel through your bloodstream to your joint replacement, and that can even happen years after surgery. So typically, the surgeon or the dentist will have you take an antibiotic before your dental appointments. Some surgeons will have you do that for a few years after surgery, and some will want you to do that for a lifetime. It's just a one-time dose that you'll take prior to those appointments. And a lot of the dentists will actually write a refillable prescription, so you just get that medication filled prior to your appointment. A discharge planning specialist will automatically be assigned to come speak with you after surgery. They will be the ones that make arrangements for the equipment that you'll need. They will answer insurance type questions, and they will also be the ones to set up the physical therapy for after you leave the hospital. When it comes to equipment, most patients usually just need the walkers, and we use the ones with just the wheels on the front, as that usually moves at the best pace for people. Sometimes the office will set up the equipment needs before the surgery, and if that's the case, the company will bring the equipment to the hospital room, and you as the patient or your family member would just take it home with you. If our discharge planning specialist sets up your equipment, they will also deliver it to your hospital room for you to take home. The only thing that we do not set up in the hospital is the cold therapy machines for home use. So if that's something that you're interested in, that will need to be set up on your own. We strongly recommend that you designate a care partner or a coach or somebody that will be available to stay with you after you're discharged from the hospital for at least a couple days. And typically that person doesn't have to do much as far as helping you get out of bed or walk. They're really just going to be there to make sure that you're feeling okay, to make sure you're safe, to stand by your side when you're walking, and make sure you're doing okay with your medications. If it's not convenient for them to stay with you, it's always an option. Maybe you can stay with them for at least a couple of days to kind of get you over the hump. Whoever that person is going to be, we do like for them to come to the hospital and be available for the physical therapy sessions so that they know how to help you once you do go home. The preference and expectation of most of the surgeons is that patients do outpatient physical therapy after they're discharged from the hospital. And outpatient physical therapy is where the patient goes to a clinic, which is like a gym or a fitness center. They do exercises and use the equipment there, and then they go home. And one of the major benefits is that patients do have access to different types of equipment. They get up, they get ready, and they go to the appointments, and that in itself is part of exercise. Both of these surgeons' offices have physical therapy departments there. It is nice if you're able to go to the ones at your surgeon's office, because if there's concerns or if you're worried about your bandage, oftentimes someone can come check in on you, or you can go to the back and have it checked out. Typically, these appointments are 2, sometimes 3 days a week. Sometimes there is a copay, so that might be something you want to check on through your insurance company. Sometimes outpatient physical therapy will last around 3 or 4 weeks. And it is important that you plan to have transportation to and from these appointments. Typically, the appointments will last about an hour. Our case manager or discharge planning specialist will confirm or make that initial appointment for you, and then you can make the appointments after that. If you do not live near your surgeon's office and you want to go to a clinic that is closer to your home, just let our case manager or discharge planning specialist know the name of that facility or that location, and she can help make that arrangement for you. Another option, which we do not use as frequently, is home health. Sometimes some of the surgeons will approve for a patient to have home health, and that is where the physical therapist comes to the patient's home and they do the physical therapy, which is typically 2 to 3 days a week. They're usually at the house for about 45 minutes per appointment. If the surgeon orders home health after the patient is discharged from the hospital, the patient will usually do that up until the follow-up appointment, and then the surgeon will typically switch them over to outpatient physical therapy at that time. The final option, which we rarely use, is called skilled nursing facilities or rehabs. And this is where patients go to a facility, they stay there 24/7 until they are safe enough to return home. Now, we do like patients to be aware that most insurance companies do not qualify or do not approve for patients to go to these type facilities unless absolutely necessary. The way insurance looks at this is they feel like it's a planned surgery, it's an elective surgery, and patients should be prepared to go back home. They will not approve for you to go to a facility just because you do not have family or friends available to help you during the day. One thing to note is that insurance companies can tell you whether or not you have coverage for skilled nursing facilities, but they cannot tell you whether or not you'll be approved or will qualify for it until after you've had the surgery, because they will need to see the documentation and they will need to see the chart to review it to determine whether or not it's absolutely necessary.
So this concludes our presentation. Thank you so much for watching. Thank you for choosing CaroMont Regional, and we look forward to seeing you for your upcoming surgery.